Hey friends! Since Cerebral Palsy Awareness Month has officially begun, I thought it might be helpful to answer the most basic question. What exactly is cerebral palsy? Cerebral palsy, CP for short, is a developmental disability. This means a brain injury has occurred affecting body movement and muscle coordination. It is caused by complications during pregnancy or childbirth. For most children, diagnosis does not occur until a few months after birth. The most severe traits of cerebral palsy are muscle tightness, high tone, which often hampers the ability to be mobile, as well as fine motor capability and impaired speech. Other less common symptoms include loss of hearing, eyesight, and abnormal body sensations and perception. Out of all the development disabilities, cerebral palsy is the most commonly diagnosed. It affects approximately 2 out of every 1,000 children born in the United States today. Although very mild cases may improve or disappear with growth and development, cerebral palsy is not curable, nor is it progressive. Improvement can be made with therapy, and medications such as baclofen can be used to reduce spasticity. I've personally had a baclofen pump, which is under my skin and my abdomen, since 2003. I call it my hockey puck, because that's what it looks like. The medicine is distributed through a catheter that runs up my spinal cord. The pump gives me a constant infusion of the medication without the annoying side effects of the oral pill. This allows my muscles to relax, so I don't have as many involuntary muscle spasms, especially in my legs. It also allows me to keep my arms down in a more relaxed position rather than up against my chest. Although, my right arm sometimes falls back into my old bad habits, because the right side of my body is more affected by CP. The reduction in spasms has somewhat eased my chronic pain. Some people who have known me since before I got the pump say the baclofen has improved my speech a bit. Speaking of my speech, you've probably heard me talk about the condition I have called dysarthria. Dysarthria is really just a weird name for speech that is characteristically slurred, slow, and difficult to understand. A person with dysarthria may also have problems controlling the pitch, loudness, rhythm, and voice qualities of his or her speech. Dysarthria is caused by paralysis, weakness, or inability to coordinate the muscles of the mouth. Dysarthria can occur as a developmental disability. Besides CP, it may be a sign of another neuromuscular disorder such as Parkinson's disease. It may also be caused by a stroke, brain injury, or brain tumor. Treatment of dysarthria includes intensive speech therapy with a focus on oral motor skill development. There are many surgical procedures available to reduce spasticity and allow for more functional movement for many who have CP. A typical person living with cerebral palsy will endure several minor and major surgeries during their lifetime. Since my pump has to be replaced every 5 or 6 years, aside from all the other procedures I've had, I'm quickly gaining on having 30 surgeries under my belt. Despite popular perceptions, I'm always happy to answer anyone's sincere questions and have conversations about my limitations, especially with kids. I'm certain that if we help them understand at an early age, more typically able children would truly befriend their classmates and neighbors with disabilities, rather than ostracize them. I think most of the disability community at large would agree. Whenever I'm out in public, I always cringe when I notice a parent hush their children and shoo them away from me when they ask, "What's wrong with her?" I know it sounds rude to an adult's ear, but it's really not. They're only noticing that I don't move or sound the same way they do. Trust me, I'd rather be able to answer an awkward question than see a child grow up fearing those who are different. When I speak to students, I usually explain the neurological damage that causes CP by using the analogy of a video game controller with a glitch, freezing your avatar no matter what you hit. It always gets a laugh and provides a familiar picture. My presentation for elementary schools is titled, "Differently Abled, Still Wonderfully Mad." The main idea being that we are all created with unique gifts and talents, meant to be used for a specific purpose in life. Some people just have to do things differently. It's a concept we all need to understand and accept with our hearts, as well as our minds. With that in mind, I'm honored to say that as Ms. Wheelchair Arizona 2022, I am now also an official ambassador for United Cerebral Palsy of Central Arizona. Please reach out to me with your questions or to share your own stories. I'd also be happy to come speak at your school, church, organization, or event. Happy Cerebral Palsy Awareness Month. Much love, grace, and peace to you, my friends. And remember to keep wearing green all month long.